We will begin with proponent testimony. Good morning.
Morning, Mr. Chair, members of the committee. I am Representative Bethany Soy from District 9. At this time, I'd like to, there's an amendment online for this bill that I'd like to move. It's 1080A.
Okay, would someone like to move that amendment forward?
So,
Okay. Representative Deutsch moves amendment 1080A. Second
Yes,
by
that's correct.
Representative Brayfeld. Okay. All in favor, say aye.
Mr. Chair?
Yes. Yes, Representative Yu.
Prior to voting on this, can we get an explanation for the amendment?
Yeah, absolutely. Would you like to explain your amendment?
Yes, thank you, Mr. Chair. This just simplifies and cleans up the language. There's no substantive change. In section 2, subpoint 2 and 3 are now combined into one subpoint, just to make it a little bit more clear.
Does that answer your question, Representative Yu?
A little bit. I do have a question. May I ask?
Yes.
Okay. Would this in any way affect the ability for anyone to have birth control?
Mr. Chair, no, it does not. Thank you.
Oh, excuse me, my mic wasn't on. So the recommendation, so with those questions answered, the motion before us is to add amendment 1080A. So, any other discussion on the motion? This is a voice call, so all those in favor say aye.
aye.
Opposed, nay. Okay, you may speak to 1080A as amended. Thank you.
Thank you, Mr. Chair. Medical providers in our state have become increasingly bold about the harmful chemical treatments and experimental procedures being conducted on children in our state. In the guise of medical treatment, children are being mutilated, sterilized, and turned into permanent medical patients. Children as young as 8 years old are taking cross-sex hormones, and a leading South Dakota physician recommends that girls struggling with their identities receive double mastectomies in high school. We need to stand up for the vulnerable children in our state. We care deeply about our children who are struggling with their identities and want to provide them with true, meaningful help, not permanent physical damage. This bill will prohibit 3 things: the use of puberty blockers to stop healthy development, the prescription of cross-sex hormones which often leave children sterilized, and the irreversible surgeries that leave a child's body permanently damaged, and that's all for those under 18. This bill subjects doctors to review by their governing board if they engage in the prohibited practices. The legislation also provides a pathway for victims who are harmed by these experimental procedures to collect damages. This bill is personal to me. As a child, I wanted to be a boy. I wore boy clothes and I came up with a name for myself, and in 3rd grade I wrote that name on all of my class assignments. However, my parents didn't take me in for chemical treatments. They just supported me, loved me, and allowed me to experience childhood. I went through natural puberty and changed to loving being a girl. I now have two children, and I'm glad to be a woman. The science is with us. Countries like Sweden and Finland, where these procedures first took off, have stopped prescribing puberty blockers and cross-sex hormones for those under 18 because they have seen the permanent damage that these drugs cause to children. The studies show that when left to progress through natural puberty, like I did, 80 to 90% of children struggling with their identities will come to accept and thrive as their biological sex. That's why this bill is needed now. We need to stand in the gap for vulnerable children and guide them towards true help and healing. So today I ask for your support in taking action and passing HB 1080. I do have a handout of endorsements of organizations that have endorsed our bill, and I would ask one of the pages to pass that out. And not listed but of note is, of course, the governor. Governor Noem also supports our bill. Thank you, and our next testifier will be Mr. Burley.
Okay, thank you. Our next proponent, please identify yourself and begin your testimony.
Good morning, Mr. Chair and committee members. My name is Billy Burley, and I'm from Twin Falls, Idaho.
and I used to be transgender. As a child, I had the reoccurring thought that God made a mistake. I'm a girl. I prayed every night before going to bed and asked God to please make me a girl before I wake up. When I was in my early 20s, I sought help for the disconnect between my mind telling me that I was a woman and my body telling me I was a man. In seeking help and doing my own research, the message I received was that I had to change my body to match my mind. After seeking any other path forward, I decided to take the therapist's encouragement and the advice I read in the journal articles and in the books to change my body. In the mid to late 20s, I started on testosterone blocker and estrogen. My emotions were up and down, but my body was changing, and I was supposedly on this new road to happiness. In my first surgery, I had a penile inversion, an Adam's apple shave, and a brow shave. After the surgery, the surgeon and nurses had difficulty stopping the bleeding from my new man-made vagina. My artificial vagina was packed with gauze and a sandbag was placed on my lower abdomen, but the bleeding did not stop. Later, my mom told me that going into my hospital room was awful. The pungent odor in the room was that of stale blood, my blood. I received a blood transfusion and plasma, and eventually the bleeding did stop. My 2-week stay in the hospital turned into a 3-week stay, but changing my penis to an artificial vagina required 2 surgeries. So about 4 months later, I was back for part 2, labiaplasty. My money was low at that point, so I didn't have any family or friends accompanied to that procedure, and I went alone. I was desperate for the happiness I believed was guaranteed to me. After this, I had more body and voice feminization surgeries, but no matter how many I had, every time I looked in the mirror, I saw a man staring back at me. I tried hard to resolve the conflict between my mind and my body, but after 7 years of trying, I had more problems at that point than I had when I first started on the road to transition. Suicidal thoughts were coming into my mind. I was in the pit of despair. The encouragement I received from my therapist and the books and the journal articles, they were wrong. In the pit of despair, I called out to Jesus of Nazareth. I gave my life and all of my problems to him, and at that point, he set me on a road of recovery that no therapist or medical professional was able to do. Later in life, after detransitioning, I heard it said that everyone has a need for acceptance, security, and significance. Though I hadn't heard this before, I agreed with the statement, and I started to think about how I had tried to satisfy these needs in my younger years. I had some problems as a child. I was very skinny, I had a speech impediment, had learning difficulties, was not athletic, and I didn't seem to fit in with the other boys. I did, however, seem to fit in well with the girls, and I enjoyed playing with them, and more so than with the boys. As a boy, I didn't feel accepted or secure, and I most certainly didn't feel significant. But if I were a girl, I believe I would have felt accepted and secure, and I definitely would have felt more significant. In hindsight, I see that I had several underlying problems that reinforced the false thought that I was a girl, including being sexually abused in the 6th grade. The therapist never did uncover, never did delve into these underlying issues, and my research on transgenderism failed to turn up anything on these needs for acceptance, security, and significance. Transitioning didn't help my mental health issues. I still had to deal with all of those after I detransitioned. As you can see, I have fully transitioned back to male. I am happily married. I have 2 beautiful stepdaughters, and I have peace of mind and body. Lastly, I was past the age of responsibility when I had made a horrible mistake. In hindsight, I am male, I was born male, and I was born in the right body. The therapists and medical professionals failed to help me with my underlying mental health problems. They identified me as transgender, and they were wrong. How often are they wrong? I ask you to please support this bill to protect children. I truly wish I would have received mental health care instead of the gender-affirming health care I did receive. Thank you for hearing my testimony.
Okay, thank you. Do we have any other pro bono testimony? Good morning.
Good morning, Mr. Chairman.
Can you push the button on your microphone?
I can
Thank
do
you.
that, thank you. Good morning, Mr. Chairman, members of the committee. My name is Don Oliver. I'm a recently retired physician, having practiced pediatrics and adolescent medicine in Rapid City for 40 years. I was proud and felt privileged to serve the families of Western South Dakota for all those years. However, I'm embarrassed by my profession now, and it makes me sad to say it out loud. I believe organized medicine, and especially the American Academy of Pediatrics, has followed an errant and harmful path in our current times, trying to keep up with the variations of the sexual revolution. We as a profession have lost our way, lost our moorings, lost our anchor. We are called to first do no harm. First do no harm. Today we are discussing transgender youth, and I think that's a prime example. We are treating children who have body and sexual dysphoria with puberty-blocking drugs, cross-sexual hormones, and eventual surgery because they are depressed. This must be an unfortunate first in medicine. Typically, depressed children and teenagers are treated with intense counseling and antidepressants if their depression has been prolonged or they're suicidal. You should know that the overwhelming majority of gender dysphoric children resolve their dysphoria when they have undergone normal puberty and have reached their late teens. They're then comfortable with their adult bodies and ready to move on into adulthood. This bill, House Bill 1080, prohibits physicians from prescribing pubertal blockers, cross-sex hormones, or doing cross-sex surgery on children under the age of 18. But it allows for access to these treatments for people over 18. I believe this bill is a needed and wise move by state government to provide protection to our young people. After all, one of the primary functions of the government is to protect the weak, the vulnerable, and the poor. A troubled youth is certainly a vulnerable individual and sometimes needs protection even from their own thoughts. To illustrate this point, I've just listened to an interview with a now 18-year-old young woman from California. She was treated with pubertal blockers at the age of 12 and by cross-sex hormones, and in her case was testosterone followed by a double mastectomy at the age of 15. By the age of 18, she felt a longing to have her own children someday and deeply regretted her previous choice. You should also know that there is very little known about the long-term effects of these treatments. Puberty at its normal time is a normal physiologic process that all the adults in this room survived. There is no long-term studies on adverse effects of delaying puberty in normal children. We know puberty blockers have adverse effects on bones, but what other adverse effects, unknown to medicine now, will show up in the future? More than likely, quite a few. In addition, the surgical aspects of these treatments are very problematic. The surgeon is removing normal, functional body parts. This is unheard of in medicine. We don't remove healthy organs from people to treat mental illness. And we will be ashamed of our profession, I predict, in the not so distant future. You've already heard that some countries around the world are putting a pause on these treatments, especially in Europe. Physicians and medical systems are backing away from these treatments in young people. Regrettably, in the United States, we are still going full speed ahead. In conclusion, I'm asking you to protect the young, the weak, the vulnerable children in the state of South Dakota. Please pass on House Bill 1088. It is the moral and ethical thing to do. Thank you.
Thank you. Do we have any other proponent testimony?
Mr. Chair and members of the committee, my name is Camille Kiefel. I've come here before you today in hopes that you'll make the right decision regarding transitioning children and take greater consideration for kids. I had a trauma history. When I was in 6th grade, my best friend had been raped by her brother. Being a girl meant I was vulnerable. I started to present more masculine, cutting my hair and wearing baggy clothing that would hide my breasts and hips. After seeing a gender therapist in 2016, I started to believe I was non-binary. Presenting and taking on another gender was a way for me to escape womanhood. Escape is not a valid way of dealing with trauma. You will have to deal with it eventually. Prior to my transition, I had spent 20 years in mental health therapy with conventional modalities. I didn't respond well to medications, saw a gender therapist, and had 2 rounds of transcranial magnetic stimulation therapy. I was diligent in wanting to heal, but nothing my doctors offered had healed me because they always saw my issue strictly as a mental one. I was 30 and at the end of my rope when I transitioned. At the time I believed I was non-binary. I struggled with severe mental illness and suicidal ideation. This should have been a red flag, yet within a few months of requesting top surgery, it was performed on me. Medicaid considered it a medical necessity. My doctor, surgeon, and 2 mental health professionals all signed off on a non-binary top surgery that has no biological equivalent in nature. I developed complications after my surgery. There were many times I didn't know if I would make it through the night. At first my doctors took me seriously, but then became dismissive. My mother talked to me about psychiatric hospitalization. If I made this mistake as an adult, a young girl could too. Not only did my surgery exacerbate my mental health issues, I now struggle with physical complications as well. I was able to work through these difficult emotions and improve my mental health by addressing my physical health. I have physical health issues that had been previously overlooked. Had those been managed, I would have never gotten the surgery. The surgery was a poor misdiagnosis. The goal of healthcare should always be to get to the root cause of the problem. Today I am more grounded than I have been in my entire life, but I am mutilated. Between my carved up body and the physical complications, I often question if there's anything on the other side. Where my breasts were hollow, I can never get them back. I can never wear a dress the same way again. I can never breastfeed. Who will love me? You know what keeps me going? Stopping this from happening to someone else. Thank you for your time. You all have a lot to consider, and I know you will make the right decision.
Thank you. Do we have any other pro testimony?
Online.
Yes, Mr. Chairman.
Yes, go ahead and identify yourself and begin your testimony.
Yes, thank you. My name is Dr. Michael Laidlaw. I'm a board-certified endocrinologist in private practice in Rockland, California. I've been studying and publishing and speaking on this topic for the last 5 years. I previously testified in South Dakota, I think a couple of years ago. It's important to note that gender identity can't be found on any physical level on a scan or a blood test. Most of these kids will desist from gender dysphoria, 60 to 98%. A high level of kids, as you've already seen, have concurrent psychiatric illness, up to 75%. Some studies, 26% had autistic spectrum disorder. Puberty is a normal part of human development. Its purpose is to achieve full adult sexual function and reproductive capacity. There is no FDA approval to stop normal puberty. Puberty blockers cause a medical condition called hypogonadotropic hypogonadism, which endocrinologists would treat and not cause. This causes stunting of sex organ development, infertility, loss of bone density development, likely negative effects on the brain, but these are unknown. The warning label for Lupron actually states to monitor for worsening psychiatric symptoms. Opposite sex hormones are given in very high doses, 6 to 100 times higher normal level of testosterone for females. For males, levels are also very high. Complications include increased risk of heart attacks and death due to cardiovascular disease, infertility, and sexual dysfunction. For females, very high levels of red blood cells, breast, uterine, ovarian cancer risks. For males, they have a 5 times increased risk of deadly blood clots. Breast cancer risk is increased 46 times. Surgeries such as mastectomies result in large scarring, loss of normal sensation if there's a possibility, and of course, inability to breastfeed. Vaginoplasty, or the creation of an artificial vagina, have complications including strictures of the urethra, prolapse, injury to sensory nerves. Phalloplasty, which is the removal of tissue, say from the arm or thigh, to create a roll of tissue, a pseudo-penis, has multiple types of complications, large scarring to the forearm or thigh, infections such as peritonitis. A recent review found of 1,731 patients showed high rates of complications such as fistulas and strictures. The studies have already shown 10 times risk of suicide completion in Sweden, and a recent New England Journal of Medicine study of youths 12 to 20 actually showed 2 deaths just this January for a treatment that proponents are saying is life-saving. For the reasons that I've stated, in my professional opinion, no minor should receive the medications and surgeries I've described for the treatment of gender dysphoria. I strongly urge a yes vote on this bill. Thank you.
Okay, thank you. Do we have any other proponent testimony?
Yes.
Yes, go ahead and identify yourself and begin your testimony.
Thank you. Mr. Chair and members of the committee, hello. My name is Kathy Grace Duncan. I grew up feeling I was born into the wrong body as early as 4 years old. I was feeling I should have been born a boy. I struggled in my childhood with deep self-hatred and longed for the day I could escape this female body. With my dad's verbal and emotional abuse, the sexual abuse from a family member, and the lack of nurturing from my mom, I had a boatload of wrong messages about being a woman. Out of desperation, at the age of 19, I took hormones, changed my name, and began to live as a man. During this time, I dated women, lived and worked as a man. I did everything I could do to live a normal life. I started going to church and got involved in the different ministries that are there. I lived this way for 11 years until I encountered the Lord. It was in this encounter I realized I needed to go back to being the woman I was created to be. In the detransitioning, I began to understand living as a man didn't resolve the pain I had been running from. I had relational brokenness and legitimate needs that had gone unmet. As I began to heal by working through the pain that told me being a woman was not safe, and the one that drove me to live as a man, I concluded this was not a sexual issue. It's a relational one, and the brokenness came from the rejection, abandonment, and abuse I endured that skewed my thinking and deepened the self-hatred. There was also forgiveness I needed to work through for my dad, mom, and others. I had been told the only way to get out of this was to go back through it. As I did that, I began to have the truth replaced with the lies that haunted me, the lies I had believed for so long. This was a process that did not happen overnight, but it did happen. Now I fully embrace who the Lord had created me to be and do not regret any moment of the process in detransitioning. I ask that you would support this bill. Thank you.
Thank you. We have about 6 or 7 minutes left. I'd set initially a half an hour per side. I'd set my timer for 25 minutes, and I don't want to take too much testimony time. Do we have any other proponent testimony?
There's one more online.
Yes.
Yes, go ahead and identify yourself and begin your testimony.
So my name is Donovan Cleckley. I am here today on my own behalf, but I'm involved with an organization called LGBT United that is concerned with the negative impact of transgenderism on lesbians and gay men, especially youth. Our concern here is that the medicalization of sex role stereotyping harms minors struggling with same-sex attraction, including those with autism and underlying mental health conditions. Learning from medical violence in the past, such as forced sterilization and the lobotomy, we desperately need a renewed commitment to medical ethics, doing no harm to the most vulnerable. Thank you.
Okay, thank you. Do we have any other proponent testimony? Only we have one in the room, so we'll go to in the room testimony next. So, good morning. Thank you.
Thank you, Mr. Chairman, members of the committee. My name is Michael Pauley. I'm Executive Director of the South Dakota Catholic Conference. The Catholic Conference strongly supports House Bill 1080. We believe that this is a bill that is vital for protecting vulnerable children, and urge you to give it your favorable consideration. Thank you very much.
Okay, thank you. Do we have any other proponent testimony? Good morning.
Hello, Mr. Chair, Matthew Monfort. Here as a citizen, I'm an ordained Christian Baptist preacher. I know we had testimony here from people that are out of state that have encountered this, and the question arises, is this here? I've spoken to hundreds, if not thousands, of young people in the state of South Dakota and the neighboring states. And I'll give you one example. Just not long ago, talking with a couple of young adolescent girls. And I'm gonna say this is not, what's driving this is psychologically our TikTok and online social media programs. I asked these two girls who told me that they were lesbians if they had had any sexual relations. They said no. They said, well, why are you considering yourself this way? And they said that it was because they were best friends. That's normal. It's normal to be best friends with a young girl or a young boy, if you're a boy. I have a petition here signed by about 100 just in the last couple weeks here, urging you from South Dakota to support HB 1080. And I would ask that you do that. Thank you.
Perfect timing. That was Mark, and thank you. And his petition has been entered into the record, so I have about 4 more minutes. So,
okay,
yes.
Just wanted. I heard the timer. Norman Woods, FHA action. Just me too. Thanks.
Okay, thank you. We love the Me Too because then we get to more people.
Lisa Gennaro with Concerned Women for America, LIC, and we're just doing a Me Too too. Thank you.
Thank you. Good morning.
Chair Jordan Mason with the State Freedom Caucus Network and Me Too.
Okay. Thank you. Do we have any other proponent testimony? Okay, and thank you for keeping us on time. But now, seeing no other open testimony, we'll open it up to open testimony. And do we have anybody in the room that wishes to begin before we go online? Good morning.
Good morning, Mr. Chair and members of the committee. Thank you for allowing me to be before you this morning to speak on this much warmer here than it is outside, for sure.
Excuse me, could you move the microphone a little
Sure.
closer for the people online?
Okay.
Thank you.
So thank you for letting me be here with you this morning. I'm Reverend Dr. Ann Dillon Schneider. I'm here from Sioux Falls. One of my doctorates is in clinical psychology, and I began accompanying transgender persons as an ordained United Methodist pastor in a rural community in 1992. I've been a mental health provider in South Dakota since 2013, and I'm licensed here as a mental health counselor. The care of transgender children, adolescents, and adults is within both my ethical and under South Dakota law scope of practice. I'm well versed in child and adolescent development and assessment and in gender responsive care. I completed a postdoctoral residency in Fargo that was focused on autism, which is an issue, as has been raised today, and on related conditions. And to earn the international credential, the specialty credential in transgender health, through WPATH, which is the World Professional Association of Transgender Health. I had to go through 2 additional years of trainings that were held at medical schools at the University of Minnesota, The Ohio State University, Mount Sinai in New York City, and Harvard, as well as the United States Department of Justice, and then pass the international exam. House Bill 1080 is not needed in South Dakota. First, South Dakota healthcare providers already have 260 pages of newly expanded evidence-based international standards of care. Those were published in September of last year, and I've sent you all copies of that. Second, also ethically, we are required to follow the evidence-based standards for each of our professions. Third, insurance companies already require that we follow each and every step of those standards, and they strictly limit already the treatment of minors. And importantly, we seem to forget that parents are part of this process every step of the way. And best practice and law indicate that they are the ones who have the fundamental right to make medical decisions for their children and adolescents. I'm opposed to this bill as it relates to my patients, to their families, and others across the state, and I will stand by for further questions. Thank you.
Okay, thank you. Do we have any other opponent testimony?
Hello, everyone.
Good morning.
My name is Elliot Moorhead, and I'm here to tell you all my story. So I am a 16-year-old South Dakotan kid who has decided to skip, well, my physics test in order to be here, which I don't mind because it's physics, you know? But I do mind why I'm here. I want you all to know that this bill affects my future, big time. So I'm a teenager, right? Without thinking about the mood swings, high school drama, and the awkward shift between the cute kid and the, God, I need a nap adult. The best part about being my age is that I get to discover and grow into myself. I bet you remember being young and trying to be the coolest you could be, which maybe didn't include bangs or some ugly colored windbreaker. The coolest me that I can be is one that can fully embrace my identity. See, the thing is, being different means I get a unique approach to becoming 100% me. Yes, I am transgender, and I'm proud. I'm in a body that has a couple more steps to being 100% me. HB 1080 will deny that opportunity I've worked hard to achieve. After 6 months of working with my therapist, I have finally received my HRT letter, which, FYI, only allows me to schedule an appointment and maybe start testing and maybe start talking about gender-affirming treatment. In addition to that reality check, you all are probably somewhat parents. My own parents were very, very hesitant in the beginning. But as concerned as they were, they knew that their child wasn't okay and couldn't just grow out of it. Taking that approach, to be frank, is equivalent to telling a teenager struggling with depression, just be happy. Science, for both gender dysphoria and depression, goes to show that it doesn't work like that, and medical interventions are needed to treat both conditions. I can account for that. Doctors, parents, and their kids know best and have the right to be provided treatment and to share that treatment. HB 1080 interferes with that trusted relationship, and it denies a kid to be their coolest selves. Don't let that happen. Thank you.
Thank you. Do we have any other opponent testimony? Okay, we'll get you, and then we'll get the next one that stood up. Go ahead and introduce yourself. Thank you.
Hello, good morning, Mr. Chair and members of the committee. My name is Samantha Chapman. I'm here on behalf of the ACLU. I'm here in opposition to HB 1080. So by specifically singling out medical care related to gender transition, HB 1080 violates the U.S. Constitution in 3 separate and concurrent ways: discrimination against individuals based on sex, discrimination against individuals based on transgender status, and violation of parents' rights under the Due Process Clause. Where a single law singles out people because they have a gender identity that does not match the sex assigned to them at birth and therefore undergo gender transition, it discriminates on the basis of both sex and trans status, thus triggering heightened equal protection scrutiny under the Constitution. It is impossible to discriminate against a person for being transgender without discriminating against that individual based on sex. The U.S. Supreme Court has explained that all gender-based classifications today warrant heightened scrutiny. There is no exception to heightened scrutiny for gender discrimination based on physiological or biological sex-based characteristics. This bill, if passed, would separately trigger heightened scrutiny for discriminating against individuals based on transgender status, as well as discriminating against individuals based on sex. If passed, HB 1080 would also violate the fundamental rights of parents to direct the custody and care of their minor children, parents' due process rights. The liberty and interest of parents in the care, custody, and control of their children is perhaps the oldest of fundamental liberty interests, recognized by the Supreme Court in Troxel versus Granville. HB 1080 bars treatment in cases where the treatment is recommended by physicians and supported by parents and their minor children, particularly here with such clear science showing that withholding care to transgender young people can be deadly. The law would seriously infringe on the rights of parents not only to guide the care of their children, but to keep their children alive and well. 3 other state legislatures have passed laws banning gender-affirming care: Alabama, Arkansas, and Utah. Federal courts have blocked both Alabama's and Arkansas's laws. Utah's law is not yet in effect, and litigation efforts remain to be seen. When Arkansas passed a similar bill in 2021, a federal court in the 8th Circuit, the very same circuit in which South Dakota belongs, enjoined the law before it could take effect, and it remains enjoined. The Arkansas court ultimately held that the law failed a heightened scrutiny and would fail any level of constitutional review. You should each have a memo with details from that Arkansas case in front of you. This bill violates the United States Constitution. If passed, HB 1080 could set off a public health crisis for transgender youth and their families and open the door to governmental intrusions into the doctor-patient relationship as well as the parent-child relationship. This bill's sponsors claim the purpose of this bill is to help transgender youth and their families. However, HB 1080 and the discourse around it is in fact harming them. Transgender young people, their parents, and their doctors are in the best position to decide the appropriate medical treatment for each minor patient. This is an unprecedented intrusion into the complex and very private dynamics and decisions of South Dakota families. For these reasons, I urge your no vote. Thank you.
Yeah, thank you. Next, opponent testimony. Good morning.
Thank you, Chairman and members of the committee, for allowing me to testify this morning against HB 1080A as amended. I am the Reverend Dr. Lauren Stanley. I am canon to the ordinary in the Episcopal Diocese of South Dakota. My job is to cover all of the state. But prior to that job, which began 18 months ago, I spent 8.5 years serving on the Rosebud Reservation as the Episcopal priest, serving 8 congregations and the entire reservation. And during that time, I worked with the youth of that reservation. I was the one who was trusted by children who go to church, who were traditional, by those who were supported by their families, and by those who were rejected by their families. Those children came to me because they had questions, and they needed to know that someone would listen and someone would love them. My job was to tell them that they are beloved children of God. If we pass this bill in this legislature, we are telling these children that they are not beloved, that they are less than, that they do not deserve. If this bill passes, it will go directly against 1079, which you all yesterday recommended to appropriations for suicide prevention. How can we pass bills for suicide prevention and then pass another bill that tells children that they are lesser than? Because this will cause them to have suicidal ideation. This will cause them to attempt to end their own lives. This will cause them to die. I sat before you and other committees a few years ago, and I asked this question. If one child on our reservations die because of this bill, are you coming to the wakes? Will you be present at the funerals? Will you take a shovel and help us fill in those graves? And will you tell the parents and the extended family why their child was not worthy of medical care, was a lesser human being, because the child didn't know for sure of their sexual identity? I promised 3 years ago that if the bill passed then, that I would contact every legislator and the governor, and that I would demand that you come down and explain to our babies, families, why their baby had ended their life because they had been told that they were not a beloved child of God. The Episcopal Church supports these children. Across this nation, we support these children. We support them because they are beloved children of God. And I beg you, in the name of God who has declared all of us to be beloved, I beg you, reject this bill. Thank you.
And thank you. Do we have any other opponent testimony? Good morning.
Good morning, Mr. Chairman, members of the committee. My name is Justin Bell. I'm an attorney and I'm a registered lobbyist with the South Dakota State Medical Association. And I'm here to express our opposition and the opposition of our members for House Bill 1080. Often in these chambers, we hear about freedom, liberty, parental rights, and limited government. HB 1080 is the antithesis of those concepts, and such would intrude on the patient-physician relationship, the parent-child relationship, and would prevent physicians from providing evidence-based medical treatment to minor patients despite the wishes of the patient and the parents of that child. SDSMA has long opposed bureaucratic and legislative interference in medicine by government that cause a physician to compromise his or her medical judgment regarding what information or treatment is in the best interest of patients. Under this proposed legislation, a physician would lose her medical license, his or her medical license, and subject themselves to significant monetary liability for simply following the Hippocratic Oath, which is to care for patients and to provide best practice medicine and his or her medical judgment. Every major medical association, or excuse me, health association in the United States recognizes the medical necessity of care for physical and mental health of transgender people. Recommendations for gender-affirming treatment are in conformance with standards of care, from available evidence supporting interventions, and the discussions of risk and harms with the patient and their parents if the patient is under 18. Receiving care is linked to reductions in the rate of suicide attempts, decreased rates of depression and anxiety, and decreased substance abuse in transgender people. These positive health effects extend to those under the age of 18. As the last speaker spoke about, and as this committee is well aware, South Dakota is suffering from high suicide rates among our teens and young adults. Already this legislative session, this committee has supported mental health initiatives, including recommending $4 million in appropriations towards grant programs for youth, and encouraging the executive board to evaluate childhood mental health and mental health services, and that's commendable. But passing this bill is a step backwards for transgender youth in this state. These are difficult conversations, and nobody's here saying that they're not, and no one here is trying to impugn the motives of those bringing this legislation. But they're best had with the parents, the patients, and the physicians, not in legislative committee rooms. Physicians have an obligation to act in the best interests of their patients and in their medical judgment in consultation with the parents of those patients. Thus, the South Dakota State Medical Association opposes government mandates prohibiting gender-affirming care and urges a no vote on HB 1080. Thank you.
Okay, thank you. Do we have any other opponent testimony? Good morning.
Good morning, Mr. Chair, members of the committee. My name is Roger Tellinghusen. I'm a registered lobbyist on behalf of the Human Rights Campaign. I'm also an attorney in Rapid City, formerly in Rapid City. I live in Fort Pierre now, forgot where I live. I want to read a statement to the committee that actually was a statement that was offered 3 years ago when a very similar bill like the one under consideration today was offered. Fortunately, it was defeated in the Senate after the House passed that bill, but it was House Bill 1057. This statement is from the Human Rights Campaign, and it's on behalf of the thousands of members and supporters in South Dakota who are submitting this in opposition to House Bill 1080, which we believe to be an unconscionable attack on the well-being of transgender children. We urge you to swiftly reject this discriminatory legislation that would serve only to hurt children, not help them. Human Rights Campaign is America's largest civil rights organization working to achieve LGBTQ equality. By inspiring and engaging all Americans, HRC strives to end discrimination against LGBTQ citizens and realize a nation that achieves fundamental fairness and equality for all. As an advocate for LGBTQ young people, we know the critical role that compassionate, culturally competent care has in the life of transgender youth who simply seek to live as their authentic selves. Transgender kids deserve to be able to live their lives in a safe environment, to be able to be supported by the people who love them, and to get the health care that they need. Laws like HB 1080 only serve to stigmatize transgender people, and that's why we condemn this piece of legislation before you today. You know, I've been involved on behalf of the Human Rights Campaign for several years now, and as those of you who are not new to the legislature, who've been around a while, you know that these issues come up practically every year. And practically every year I sit before a committee that's considering this anti-transgender legislation, which that's what this is. To remind you how marginalized these kids are. They're not like ordinary children in the sense that they're ostracized by their own friends and neighbors. And for this legislature to believe that it has the ability to know what's better for them than their own personal physician or their parents, I just can't understand that. And I hope you will join in opposing this kind of legislation. These kids need to have care and compassion. You know, the motto of doctors that I'm familiar with is do no harm. And yet this bill will prevent those very doctors from treating their individual children patients who are there for their help, reaching out for their help. This bill will have an impact on transgender kids. Not a good one, in my opinion. I believe that the propensity towards suicide and certainly depression is much, much higher in transgender kids. And for this legislature now to push them down even further and say that you know better what's better for them than their own doctors, I just believe that's really bad policy, and I would urge you to oppose this bill. Thank you.
And thank you. Do we have any other opponent testimony in the room? You have one, and then we may go online for the next one. Good morning.
Good morning, Mr. Chairman, members of the committee. My name is Lindsay Ryder-Rapp. I'm a registered lobbyist for the South Dakota chapter of the American College of Obstetricians and Gynecologists. We, like the South Dakota State Medical Association, oppose efforts like this to interfere with the confidential relationship between a patient and their physician. Patients, including youth, must have options to discuss gender-affirming care with their trusted physician to determine, together with their family, what care is best for them. But here, we would subject a physician to mandatory licensure revocation and open them up to civil claims for providing, such evidence-based care. For these reasons, we would ask you to oppose House Bill 1080, an effort to attempt to regulate systems of care. Thank you, Mr. Chairman.
Okay, thank you. I think next we'll go to Dr. Dan Heineman online. Doctor, are you ready?
I am ready. Can you hear me okay? Can you hear me okay?
Yes, we can hear you just fine. Thank you.
Thank you. Good morning, Mr. Chairman and fellow committee members, and I want to thank you for allowing me to testify virtually. I am coordinating a health policy class for the Sanford School of Medicine fourth-year students, and you may get to see 5 of those students in the halls of the legislature next week, and I wasn't able to make the trip. My name is Dan Heineman, and I'm a family physician and a registered lobbyist for the South Dakota Academy of Family Physicians. The Academy represents over 500 physician residents and students in South Dakota. The Academy and its members are committed to providing comprehensive, high-quality health care to the citizens of South Dakota, and we speak today in opposition to House Bill 1080A. The South Dakota Academy of Family Physicians is a component chapter of the American Academy of Family Physicians. The AAFP recognizes that diversity in gender identity and expression is a normal part of the human existence and does not represent pathology. The AAFP supports access to gender-affirming care for gender-diverse patients, including children and adolescents. Gender-affirming care is part of comprehensive primary care. Family physicians are uniquely suited to provide gender-affirming care because of their whole person focus. Family physicians are deeply concerned by the growing trend of recent legislative efforts to criminalize care directed at specific patient populations. HB 1080 does that. Physicians must be able to practice medicine that is informed by their years of medical education, training, and available evidence freely without threat of punishment. Clinical guidelines instruct physicians to use mental health resources and support the child and their family. Surgical intervention is not part of the initial clinical guidelines for prepubertal children. Therapies are started only after significant mental health evaluations, extensive medical evaluations, to assure that the recommendations for care, if indicated, is appropriate. Parents are also part of a significant informed consent process and have the final say in the decision to treat or move forward. Puberty blockers are reversible, and the effect stops when medications are stopped. Some additional facts. After Arkansas became the first state to ban gender-affirming healthcare for minors, the state experienced a sharp uptick in suicide attempts in young people. A longitudinal study of 50 transgender adolescents found that suicidality was decreased by a statistically significant degree after receiving gender-affirming hormone treatments. As previously stated, puberty blockers and hormone therapy are only become options after robust and mental and physical evaluations and long discussions between parents, adolescents, and their physicians. For these reasons, South Dakota's family physicians ask you to defeat HB 1080A. The defeat of this bill will allow physicians to provide the evidence-driven evaluation of adolescents and their parents who seek information and options and the true risk of gender-affirming care. Thank you for your time, and I will stand by for questions.
Okay, thank you, Dr. Hyman. I'll turn my alarm off. It's going to go off in 28 seconds. We have time for one more. Do we have any other Oakland testimony?
Online, Dr. Torbert.
I'm Dr. Nicholas Torbert.
Yes, go ahead and introduce yourself and begin.
Hi, I'm Dr. Nicholas Torbert. I'm a currently practicing board-certified pediatrician and neonatologist in Sioux Falls, South Dakota. I'm here to urge you to vote no on House Bill 1080. I grew up in rural South Dakota, went to college at the University of South Dakota, and then medical school in Iowa. I've been practicing medicine in Sioux Falls in some form for the past 9 years, and I've been practicing pediatric medicine for 14 years. I have served as a primary medical consultant at a pediatric and adolescent psychiatric hospital, a pediatric hospitalist, general pediatrician, and neonatologist. I hold academic ranks at a state medical school and have a master's degree in ethics and values. Gender dysphoria is a clinical condition that is marked by the stress due to an incongruence between a patient's gender identity and sex assigned at birth. This incongruence can lead to clinically significant distress and impaired functioning in many aspects of the patient's life. If not treated or treated improperly, gender dysphoria can result in debilitating anxiety, depression, and self-harm. It's associated with extremely high rates of suicide. I have personally managed patients after suicide attempts because their gender dysphoria was not treated or not treated appropriately. Pediatricians, family physicians, psychologists, child psychiatrists, and pediatric specialists work together with trans youth and their families to determine the course of treatment that is best for a young person. For minors, a parent's consent to treatment is an integral part of building a plan of care for these adolescents. Because of these highly individualized care plans that each patient receives, a one-size-fits-all policy will inevitably harm patients by intervening between them and their doctors. Legislating what can and can't be offered to individuals by their physicians robs the people of South Dakota of their freedom and autonomy. Medical decisions belong to trans youth, their parents, and their physicians. If passed, HB 1080 will prevent me from recommending medical care that is supported by many major medical associations in the United States, including the American Academy of Child and Adolescent Psychiatry, the American Medical Association, the American Academy of Pediatrics, and the Endocrine Society. There are standards of care in medicine dictated by research. Taking this therapy off the table for South Dakota individuals will only injure the hardworking people of this state. I pray that legislators will not take away the medical rights of the people who elected them. It was always my dream to serve my community through medicine. The relationship I have with my patients and their parents is sacred. I do not take this trust for granted and carefully consider each recommendation I make before advising any specific medical guidance. I am careful to offer patients what I believe to be in their best interest, given the nuances of their condition, environment, support, and wishes. Physicians take an oath to do no harm. This bill forces me to break that oath by preventing me from sharing certain medical treatments with patients who need it, risking the lives of South Dakota's children and stripping them of their rights to individualized medical care. I urge you to vote no on this bill. I'll stand by for questions. Thank you.
Okay, thank you. So with that, we will end testimony because we have opponent testimony. We can't offer rebuttal to the sponsor of the bill. Good morning.
Thank you, Mr. Chair and members of the committee. I'd just like to go over a few of the points that were brought up by the opposition, and then we can move on to questions and be ready for that. One thing that was mentioned, that the standards of care come from WPATH. And what is that exactly? It's not a government agency. It's not an objective organization. It's a trans activist group. And its president is Dr. Marcy Bowers, a man who identifies as a woman and is a self-described pioneer in the field of gender affirmation surgery with her own transgender reality show. So I think we need to take it with a grain of salt when it's activists that are writing their own standards of care. And it is not true that the medical community is in total agreement. The fact is, there are no long-term studies on these procedures. Our state regulates just about every industry that exists, and the medical establishment is not above the rule of law. And medical professionals can make mistakes. Heroin was once used medically and is now completely illegal. The AMA once ran ads promoting cigarette usage, the exact opposite of what they're doing now. So the fact is that the medical community can get things wrong. A lot has been said about parental rights, and I agree, parental rights are very important and something that we should support. But there are a lot of things that we do not allow parents to do. They can't consent for a marriage if their child is underage. Their child still has to be 21 to drink, buy cigarettes, etc., etc. The state does have a legitimate purpose, as it was stated before, in protecting vulnerable people. And we are not punishing parents by our bill. There's nothing in there that punishes them at all. So we know that they care deeply about their children, and we want to support them. You've heard a lot about suicide rates, and currently there's only one long-range study that comes from Sweden. It does show that clients who go through these procedures, they feel better for the first couple of years, but 5 to 7 years after transition is actually the highest rate for suicide. That's when you're about 18 to 20 years old. So these procedures clearly do not solve the suicide problem, and it's still an epidemic. Puberty blockers are not totally reversible. In fact, they're being used off-label when they're used for this purpose. They are meant to stop precocious puberty, which is something that occurs long before it's supposed to, at 5 or 6 years old. And just for example, Lupron is one that's used quite often. Even when it's used for its intended purpose, it still causes permanent bone damage. Finally, we should look to countries like Sweden. They've been practicing these procedures for decades, and they've stopped. They've stopped because they have seen the long-term effects. They've seen the permanent damage and sterilization that it causes to children. So I would urge you to look at what they've been through. Do we need to take decades here, or can we learn from their mistakes? I'd ask you to pass this bill. Thank you.
Okay, thank you.